do with me anymore? What's the deal?
We're in a waiting room.
Oh, nobody's around. Nobody can see. Come on. Come on.
Stop! God.
Times anyway, when's our damn appointment? I can't rest. Hot little mama next to me, and they make me wait here with you. I can't even touch you. They get pissed off.
God.
When are they gonna come out of here?
Damaris Harper?
What is that? Ooh, look at
Hi.
that. I'll stand back here. Everything's bigger.
Oh! God.
How are you doing? Are you in some pain right now?
My back has been killing me for... I don't think I can take it anymore. I can't wait another month.
Do you always wear those shoes?
Well, Ricky thinks they're hot and he makes me wear them. He just bought me a red pair.
Hooker shoes.
Well,
Get your hand off me.
that's probably not the, I have the wrong chart here, so just give me a moment here. But
Look at you. Everything's like big. All right. Can you blame the guy?
I think there's some really good chart on the chair.
What?
The chart.
No, I found the chart.
Okay.
Thank you.
You're trying to be helpful. I'm just paying attention to me.
Okay, so what I was saying about the shoes, so the back pain, you probably really need to wear some more comfortable shoes. It's not good. The increasing weight in your stomach is shifting the center of gravity.
Like right here?
Yeah, and
Yeah, right there.
Like where?
Yeah, I like that.
and Ricky, you can actually help her out with that if you give her some massages and apply
I'll give you
heat.
some massages.
It will
Did you hear
really
that?
help.
Did you hear that?
Can you just let her talk?
But I really would wear comfortable shoes and just work on your posture. And when it really starts to hurt, take a break and put your feet up. You really need to rest.
Okay, I understand.
You don't.
What do you
You
mean?
don't understand crap. You're always cleaning everything, get up to one more thing to the nursery. I swear, and then after you get done, it's, oh, my ankles are swollen, my back hurts.
This guy just plays the video game like all day.
Well, you're on
I'm the only one working. I don't want this baby to come home to a nasty, dirty house. I don't want him to get sick.
Well, Ricky, you know that cleaning is actually really normal. It's called nesting. And she's basically getting the house ready for the baby. She kind of can't help it. It's a natural urge.
Stop cleaning that, pay more attention to me.
Leave me alone. You hear her? I'm not cleaning it. You need to do something. I rest, you clean.
Well, are you guys having any other issues besides the cleaning?
I do.
Okay.
The whole thing, you know, I mean, come on. Like I said, look, everything looks so much better than it did before. It's all big and plump, round, and nice, and don't let me touch it. She just want to do it all the time. A couple months ago, she couldn't keep her hands off me. Now,
Look at this belly. I mean, I'm lugging this around. I feel huge stretch
Sorry.
marks. Faster. Stretch marks all over my sides. Like, who would feel sexy in this? I don't feel sexy.
you look sexy.
I don't feel sexy. I don't want him touching me.
Well-
He just needs to leave me alone.
Well, is there a reason you're not believing him that he still finds you very attractive?
Well, I don't know.
Are you maybe nervous about having sex with your husband?
Well, I don't feel good about myself. And I've told him too, the baby can hear us. He can hear us.
Quiet
And
down.
you can hurt him.
Well, I wouldn't worry about hurting the baby. And it looks like from your chart that you've had a normal pregnancy so far. So really, sex is perfectly safe as long as you're feeling like you want to. It is. I mean,
Can he hurt him? Like, can he hurt the baby?
No. As long as you don't have any vaginal bleeding or any pain, and as long as you two take it slow, I don't want you swinging from any chandeliers.
What? You hear that?
You know, you do like the oral sex. We can do
No,
that instead.
No, don't tell her
Hey,
that.
I can't help you like it.
I don't like it. I don't.
I don't judge. This is a safe environment.
But I don't like it, just for the record.
Okay. I'll put that in the chart. Okay. discharge and odor can increase significantly. So I'm not sure, but you guys can try. It's important not to blow any air up there.
I don't like it. I don't like oral sex. For the record.
It's in the record. I put it right here.
Okay. Can I see?
It's right here. See, does not enjoy oral sex.
Okay.
Okay.
Put it on the front of the chart so when I walk in the front they can see that I don't like oral sex.
We're all out of those type of stickers right now. So. Now, if you do decide to do it just to humor your husband, you know, you're wanting to be nice to him, and you know, you just let him do it.
Only if I'm nice.
Just the air
If
thing.
you're clean, you might.
You guys, I'm trying to help you. You wondered why I was running behind. It's because couples like you come in here and try to have like their whole life story.
She is a bit.
So, just don't blow any air up there because
Why?
it can cause
Why
an
can't you
Oh, I
embolism.
thought you didn't like it.
I don't like it, but I want to
Shut up,
know.
Zip, forget it.
It can cause an air embolism, which can be dangerous for you and the baby.
See, you can't touch me there.
I don't want to get steps.
And as far as your appearance, you don't feel pretty, but you know, the stretch marks will go away with time for the most part. Have you been putting any lotion on
Oh, I
them?
have, but then there's this line that starts from like right here,
That's the trail to the happy spot.
but it's getting darker. It's getting darker.
That happens during pregnancy. It's called the linea negra, and it'll fade over time.
How does it fade when it got so dark? It
It's
just does?
just our bodies are amazing.
Okay.
They sure
Yeah.
are.
Ricky, touch me!
Maybe you should try complimenting her a little more on her beauty
You want to sit down and walk around?
and not so much on her sexuality, and then she might come around a little more. She might feel a little more comfortable.
Ready?
Any other questions? Damaris?
No, I did come here. I have a few questions. I know like we pee a lot during pregnancy, but recently I've been tinkling in my panties without even noticing. I just tinkle, and then there's like a lot of pressure down there. And like the other day I was gonna get up from my chair, and like the pressure was so much that it kind of hurt, and I had to pause. I was like, I couldn't get up, and I was like that, and because it hurt.
Were you wearing those shoes at the time?
I probably was, but the pressure was there.
Okay.
It wasn't like the feet.
Well, a lot of times, due to the enlarged uterus, that pressure is going to be there, and you'll notice it when you're walking or standing.
So nothing's wrong?
Nothing is wrong, and it's just because you're nearing the end of your pregnancy. If it gets, uncomfortable, that's one of those times where you need to take a break and put your feet up and just relax. Okay. Well, it looks like you guys are all set. I did have a couple brochures I wanted to give you. This one is on some of the different safe sexual positions for the third trimester, since you guys were asking a lot of questions about that. And
She
then,
said no from behind. That can give it an air
No,
embolism.
that's blowing. I can blow.
Oh.
no, yeah, actually, that's a good. You'll see it in there.
Okay.
And then this one is just on what to expect during the labor and delivery. And it also has some signs of preterm labor in there for you guys to read over so that you know what to expect, okay?
I'm still a little nervous about having a baby.
Yeah, and that's pretty normal. Do you have anyone else you can talk to, family members that have maybe had
I
children?
don't have anybody.
Well,
I don't have anybody.
Well, the best thing you can do is to just really be educated about exactly what's going to happen, and that might help, ease some of your fears. And just know that it's normal. Everybody's really nervous at this time, and you'll get through it. Okay? You guys are all set.
Okay, thank you.
You're welcome.
The end.
Jeff, can you see